Good morning and welcome to our live show today. Hair restoration and rejuvenation, platelet-rich plasma for androgenetic alopecia. Now, this is a 2.5-year update with Dr. Jeffrey Rapaport. My name is Craig Ure and I'll be your host today. Now, in today's interview, Dr. Rapaport is going to update us on the results he's getting and all the technology advances and changes that have occurred with PRP for hair restoration treatments over the last 2.5 years since we did the first interview on this topic. Good morning, Dr. Rapaport. Welcome.
Good morning, Craig.
And
thanks for having me. I can't believe it's been 2.5 years.
I know it's been a fair length of time. 2.5 years since we first did this particular topic. So my first question over that period of 2.5 years is, how many treatments have you done in the last 2.5 years since we first did this interview?
You know, I was trying to calculate that. We do between 20 and 30 treatments a day. I'd say somewhere between around 2,000 or more.
2,000?
Yep. Wow.
It's a lot of treatments.
Well, it's a long time. That's 1,000 a year, and 20 or 30 every day adds up.
Okay, well, so tell me, over the 2,000 treatments, I guess there's a lot of technological changes in the industry. What technological advances have occurred with PRP technology over that period? What's changed?
A lot of things have changed. The primary thing that has changed are the devices to prepare the PRP are now allowing a higher concentration of PRP and a more pure concentration of PRP. And we believe that a higher concentration, somewhere between 4 and 5 times the concentration that's in the plasma, is a more desirable number. And we also now think that elimination of red blood cells and white blood cells is very helpful to get the hair to grow and to decrease the amount of inflammation after a treatment.
Mm-hmm.
Other things that are changing with technology is that we now use a cold air blower at the time of the injection process. In some cases, we will add lidocaine to the preparation, depending upon what we're looking for in terms of spread. And it's not the technology of the PRP, but it's the technology of the treatment. We're now doing more combined treatments with PRP and other things for hair loss.
So in terms of, it's like most things do advance. In terms of this particular treatment, are you finding then the results are changing in terms of either longevity of the results or the speed in which the treatment works or the efficacy? In these advances over the last 2.5 years, how has that affected those elements?
I think that we're getting a higher percentage of people responding with the higher concentrations, and we're learning a lot more about the variability in the treatment. And one thing that I have been noticing is that younger patients seem to do better, and people are losing hair for less duration of time seem to do better. We are also noticing that different combinations, in addition to the PRP, seem to be able to prolong the time period that one needs for the maintenance treatment, so that you do not need to continue the PRP as often. Well, initially, we still do our treatments once a month for 4 months, unless people traveling from great distances, which we have a lot of them, and which we will consider doing every other month. And then we assess our patients as to what their goals are. And after assessing what their goals are, we need to determine how often they need to be treated, and if they're responding well, they're not responding well, and once we go through that entire process, we are making changes on the fly in terms of frequency of treatment and additional things that we're adding to the treatment.
Okay. Well, that segues me into one of these other questions, which is which you did actually just broach on there. But are you finding one type of patient more suitable or gets better results than another?
Initially, I evaluated the patients prior to starting them on the treatment, and I think that's extremely important. But now we go 2 or 3 steps deeper to determine who is a good candidate and who is not a good candidate. It's important for your candidates to be those that have genetic type alopecia. Those are the ones that respond the best. Now, with men, it's pretty easy to see that because 95% of the men that come in will have an inherited type of hair loss. When we get women patients, I believe that there is what's called multifactorial disease, where women have a lot of different factors that cause hair loss. And in the past, where we didn't really push to find each of the multifactorial aspects, we now investigate much further and see if we can eliminate the multifactorial aspects that are negatively affecting the hair growth and negatively affecting the treatment. And this is usually a bunch of different things that cause hair growth, mainly in women, but also in men. And if we can eliminate the things that are causing the hair growth, then the treatment will work better.
Okay, that certainly makes sense. Now, the patients you treated 2.5 years ago, I'm just interested in those people that, and I know we've got some pictures, some before and afters and case studies that you want to walk through. So I'm going to pull those pictures up in a minute.
Those are not people that were treated 2.5 years ago. Let me give you a little, and I know okay. you want to follow up on the ones that we've treated 2.5 years ago.
Yeah, I was just really interested to know what sort of results were they getting, the 2.5 year ago people.
Remember, we're treating something that is a genetic disease for the most part, and it's important to continue the treatment. For those of my patients that have continued the treatment, they have done extremely well. There are some that have dropped out of the treatment. We've retained about 70% of the patients. So for the 70% that we've retained, they're still doing very well.
Okay.
There are some that have dropped out for their various reasons. And the ones that have dropped out are, at this point, I don't know because I haven't seen them where they are or where they're headed. But our retention rate of about 70% is, at least in my mind, shows that it is working for approximately 70% over a 2.5 year period.
Well, that's excellent. You're never going to get 100% of anything, but certainly 70% is very good.
It may even be higher in that these people don't feel that there are some diseases of the scalp that we're treating that are not genetic, and they may have kept their results.
Right. Okay. Well, this next question here is: does the patient still have to have as many treatments, or has the frequency of treatments changed? So as these advances and these different modalities of treatments that you do, has the frequency of treatments changed at all? Do they have to have as many over the course of whatever period, or has that reduced or increased?
I believe that the initial number of treatments that we use to get the hair to a growing stage has stayed the same. It's usually monthly for 4 months. But the maintenance treatments have decreased because we are adding on other items such as minoxidil by mouth,
right.
Propecia, finasteride is the same as Propecia. We're using topical as well as oral Propecia, we're adding progesterone. All these other things help to prolong the results so that they're additive with the PRP, and we can do less treatments for those patients. But having said that, every patient is individual. So we have to see how the results are. I think the best judge for the results are to look at the pictures and also to see how much hair loss the patient has and that their hair loss has not started reawakening. And if the hair loss is still the same as it was prior to starting or it stays down, we keep trying to extend the maintenance phase as long as we can to use as a baseline the fact that patients do not develop increased hair loss or any hair loss like they were before. And we, with other things, we now use something called a Theradome, which is low light laser. All these add-ons add a little bit to it so that we can extend the time period.
Right. Yeah, that makes sense.
So in summary, the initial period is about the same. The maintenance period time sessions are extending out more than they were before.
Okay. So basically people don't have to come as often for the maintenance.
That's correct.
Okay. Now I know, well, that's great for people who come for, you know, extended travel. That certainly helps that group. Now, when I look through your 2.5 years of before and after pictures on your website, on the prphairmd.com website, which is becoming an extensive library of before and after pictures, I noticed there's quite a fair number. I mean, you have a good selection of men and women, but I noticed there's a fair number of women before and afters on there. Why is this particularly with so many women? Do they have more of a particular problem, or the results can be different in women?
The reason I show more women is I don't really think the number of women has exaggerated, but women have all different types of hair loss. And if you look at the men's pictures, they're very similar, but the women's pictures have a lot of different types of hair loss. They have hair loss in the front or temples or edges. They'll have diffuse thinning over the top, but keep a frontal hairline. There's so many different patterns for women that I show quite a few women's pictures so that your listeners and my patients can relate to a set of pictures that are similar to them. A lot of the men are pretty much the same. They're losing in the front, they're losing in the M shape, etc. But if I was asked, it's probably 55% women and 45% men in our treatment population.
Oh, okay. Oh, that's a fair equal, more or less equal percentage. Well, that probably, you know, in terms of patterns, I know you sent through some pictures. So if I can share the screen and you can just walk us through these pictures that you sent, which you're probably going to reference different patterns, which makes sense. But if I just share the screen, you should be able to hopefully see the screen now. Do you see the screen?
Yep. This picture shows two things. Number one, which is highly unusual that we see, is that you get an increased density for men, and this fellow had very low density, etc. The color of the hair does get darker also, and we find that to be a fairly common result. And this shows this is a younger guy, and younger guys and younger patients, because they've been losing their hair for less period of time, seem to do very, very well.
Mm-hmm.
I thought this was a remarkable result.
Definitely looks pretty dramatic to me, that one. You can definitely see it's darker.
Yes, the darkness makes a difference.
Okay. Let me, tell me when you want me to move the slides on.
Let me see the next slide, sure.
Okay.
This is a 38-year-old male, even though he looks much younger from the picture. And this male demonstrates something that I've learned in the last couple of months. And that is something that the hair transplant surgeons have known for years. And that is, if we mix Propecia or finasteride with our PRP, that we can get really spectacular results. And if you look how thin his hair was on the left and then where he is now, the addition of Propecia made a huge, huge difference. And there are side effects with Propecia. If people are looking on the internet, they can get extremely concerned about what they read on the internet. There is reported cases of people who have developed post-Propecia syndromes, and we use a fair amount of Propecia, especially in our male cases that are have lost a significant amount of hair, and we've seen some remarkable results. And this is an example of a guy who's 38 years old, who's gotten a tremendous set of regrowth due to the combination of Propecia with his PRP. And the reason that it works well is that there's an enzyme called 5-alpha reductase in the scalp that wants to miniaturize and make the hair fall out, and Propecia blocks that. Once you get rid of that block, then the growth factors in the platelets can work unimpeded, and it makes the platelet growth factors much more successful.
Well, that's certainly a pretty spectacular result, is that one?
Yes, it is.
All right, let's move on to the next one, this lady.
This lady demonstrates quite a few things. She's actually a straight PRP patient, nothing else added. And you'll see that she had a huge amount of hair loss, and that the texture of her hair was so completely different, so thin and wispy. And with 6 treatments, look at the texture of her hair.
Yeah, looks totally different. Totally wiry, stronger.
Yep.
So that's just PRP, nothing else?
That's just PRP.
Wow, she must have been pleased with that result.
We have a lot of pleased patients. Yes, she was very pleased with her results. And she knows that this is genetic and that she's going to have to continue with it. And anybody that tells you that PRP is just a 1 or 2 time treatment, that may be the case in certain types of diseases like alopecia areata, where once you get it to grow back, there's no ongoing process. But for most people, there has to be some sort of maintenance.
Right. Okay, let's move on to the next. I think this looks like another lady.
This is a traction alopecia, and this shows you, this is usually seen in African American women who over style and over braid and over relax their temples or edges, and we're able to get the hair to regrow. This traction alopecia for years was thought that one really couldn't get very much improvement, and we've been able to show that traction alopecia works pretty well for women if the traction alopecia hasn't been going on for an extensive period of time.
And that's just one treatment?
Yep.
Yeah. It's interesting. I mean, all those people that are listening, I do strongly suggest you go to prphairmd.com, because I know Dr. Rapaport on that website, when I had a look through it, lots of before and afters, so you can like relate any of the before and afters to maybe your particular pattern. And there's a lot of video testimonials on there, I noticed as well. A lot of happy patients telling the story. So yeah, we got another one here.
This is another case of traction alopecia, but this one didn't respond quite as well as other ones. And if you look at the picture on the left, if your viewers and people watching this hangout see that as long as you have some hairs growing there, it's possible to recruit some additional hairs and hopefully get that to fill in over time. This is only 4 treatments. We anticipate that this has to continue for a couple more sessions and then maintenance.
So when I look at this, it does look it does look pretty impressive on the left. Looks balding on the right. The hair looks to be filling in. I mean, how young is that hair on the right? Is that, it sounds like more treatments are going to fill it out more, but that it looks like it's not grown fully yet either.
That's right, most likely, but I have to be honest with you, you may not be able to get that much more fill-in. We don't know. This is after the 4 monthly treatments. Usually I tell people that you don't have a final result until 12 months. There are studies out of France that show that when they did PRP treatments, that some people only got the hair regrowing between the 8th and the 12th month. So you have to be patient. And that's something that is difficult to do when you have not much hair, but you have to be patient.
Right. Okay. Well, that's the end of that slideshow. Let me just stop sharing that. Should be hopefully maybe back seeing me. So my next question would be, looking at those different cases, what does a typical treatment cost today? I mean, I guess there's different cases of people. Has the prices changed in the last couple of years? Is it less expensive, more expensive? What sort of price bracket are people expecting to pay for these types of treatments?
I'm one of the few people that has what I consider to be fair and reasonable prices. My prices have not gone up in the last 2.5 years. And we charge based upon whether one needs 1 or 2 vials of PRP. And we charge $600 for 2 vials and $400 for 1 vial. And I would say on the average, 65% need 2 vials and 35% need 1 vial. So it's either $400 or $600, and that would be monthly for 4 months, and then we go to a maintenance and see what has to be done.
Right. So it's cost effective.
I think we have very reasonable prices. I think if people look around and see what other prices are being charged, we try to keep our prices in a reasonable low category so that people of all walks of life can come in and get the treatment, and it isn't a financial burden to them. And I think that that's one of the reasons that we are so busy, because we keep our prices in a reasonable or acceptable range so that the average person can afford it.
Well, that's very helpful. Yeah, keep it in the right sort of price bracket. It's not always price though, is it? When I go and look at whatever I'm buying, I don't always necessarily look at the price. It's down to either the surgeon or the doctor or the whoever who's doing the work, because it's not just, I guess everybody may do PRP, but not everybody does it the same. You know, there's
absolutely
like every other treatment.
There's a million different protocols. There's a million different ways of doing the PRP treatment, and I think that the protocol that we've developed, I've had 2 articles published since I spoke to you last time, and my published articles explain to other doctors how to do the treatment, and my treatment that I developed is being well accepted throughout the country and is working very well for a lot of doctors. When I go to different meetings and I discuss things, I have people come up to me and they're thanking me so much for developing this technique that I'm using, and because it's not painful, and the patients are happy and they're getting good results. So when people come in and they see that my prices are more reasonable than most of the people that I'm teaching how to do this, they say, why aren't you raising your prices? And I'm just not raising my prices, because I'm trying to keep this as something that can be a service to the community.
Well, that's very gracious of you. Just to expand on that, I noticed that on your website you do a lot of CME credits and it looks like you speak around the country talking to doctors. Like, you are the doctor who educates the doctors on this particular protocol and treatment? Just expand on that, just for the listeners.
I have gone in the last year and a half or 2 years, either once or twice a month, to different areas of the country and spoken to doctors groups to teach them how to do PRP, and also to teach them my technique of PRP because it's been successful. And when I go to these individual groups, we usually do a hands-on session also, so we teach them how to actually do the injections.
Right.
And people are utilizing the technique that I developed. It's very different than what was in the literature before, where they would put PRP on the hair and microneedle it in. We're doing injections into the subdermal space, spacing it certain ways, using different concentrations. We have our own protocol, and we have educated people throughout the country on my protocol, and it seems to have taken off, and people are very happy with this protocol. I also wrote 2 articles, as I mentioned, one in Metastatic, the other one is in the Dermatologist, about the protocol and about the treatment pattern. I've lectured to hair transplant surgeons about the treatment and the treatment protocol, because it is a little different. Everybody has their own protocol. Nothing is 100% standardized in this field, although we're getting there. And then I also work with the company who produces some of the tubes, and they're doing studies, and I'm their medical consultant for any of the studies that are going on, which are going on with quite a few luminaries throughout the country. And those studies are going to give us some more information, but my role is to give them advice and to help them develop protocols and techniques that will end up in good results.
Excellent. So Dr. Rapaport is the doctor that all the other doctors listen to when it comes to PRP. Excellent. So what's going to be the next evolution? We're 2.5 years on since we last spoke. What do you believe is the next evolution in PRP for hair restoration? Where is it going to go from here, do you think?
The next evolution is going to be we're able to isolate exactly which growth factors are important and concentrate those, so we could probably get a better result. And then after we're able to do that, the next step is probably going to be able to take your hair, clone it, and after you clone your hair, then be able to put the hair back into the scalp without having to take it from the back part of your head, like in a transplant, where we can clone it and bring it directly back into your head by growing it in the tube and then implanting those.
Really? So you can that growing hair in a tube, cloning it, and then putting it back in your hair?
Yep, probably 5 to 10 years. There are a lot of people that believe that using stem cells are helpful, but I don't see stem cells as doing anything else rather than increasing the amount of growth factors in the injection. And I don't really think, at least in my mind, stem cells is overhyped, and I'm not so sure where the stem cells are going to lead us. But I do think that isolating the different growth factors so we know exactly which growth factors are working, and then either taking those growth factors from PRP or synthesizing them and then putting them back in the scalp.
Interesting stuff. So, like I keep telling you, when you look at my...
Yeah, well, you know, Craig, it's
I'll be waiting for that test tube cloning hair and putting it in.
It's funny that I had a picture I wanted to send you. It wasn't on my website, but we have been doing people such as yourselves who have fairly bald areas, if it's for a shorter period of time, and we have been combining them with the finasteride topical, which is Propecia, or combining it with finasteride orally and doing the PRP, and then combining that also with a bunch of different things. And we're able to actually grow hair on, remember we talked about last time that if the area was totally bald that we couldn't do anything?
That's right.
It's no longer the case. We are able to get hair growing in areas that look totally bald with our new combinations. So my selection of patients is now a little bit different because I'm able to treat people who have balding areas with different combinations and able to get some hair regrowth. It's not 100%, it's not all the people, but we are able to do things that we weren't able to do before.
Oh, interesting. Just expanding on that, like we digress a bit slightly here, but in my case, this has been here for a number of years. Are we talking about people who have just started to go, or cases like me who it's been like this for a few years?
I think 5 years is the line, and if it's more than 5 years, it will probably be pretty difficult. If it's less than 5 years and there's a balding area, although I have some patients with even more than 5 years. So my answer to you is that with this new combination, it's mainly the men that were able to do things that I didn't think we could do before. And with this new combination of using the finasteride topically or finasteride orally, we are able to get results that I never thought we were able to obtain before.
Interesting. So next time we'll have an update of those types of patients.
Yes.
All right. So, in closing here soon, if someone listening, looking at this interview today, if someone's interested in having a consultation with you, meeting with you, what is typically the procedure? Where would they go to? Who would they call? What's your procedure for seeing a prospective patient?
Well, we're in Englewood Cliffs, New Jersey, and probably the best thing to do would be to call the office and ask to make a consultation. Most people want to read about me first. They should go to the PRP Hair MD website, PRP Hair MD, and look at my before and after pictures and answer some questions. We do quite a few consultations every day. There's quite a few doctors that will do virtual consultations, and I do not find that I can make a proper assessment with a virtual consultation for hair loss. I need to look at the individual hairs. I need to look at them magnified. I need to pull on the hairs. So we can't do with virtual consultation. I know that there are other doctors out there that are doing virtual consultations, and I don't really understand how you can do a complete examination with a virtual consultation. But if someone is willing to come in, I have people flying in from all over the country, and we can usually do the treatment on the same day as they come in and set up a treatment schedule for them. And most people that come in, I mean, the interesting thing is that we do not accept every patient for treatment. We do a very thorough examination, and if someone is not a candidate, we will tell them you're not a candidate, and we will work with them to try to get their hair to grow back, but we won't treat them with the PRP.
Right. Okay. Well, that makes sense. Okay. So my final question would be: do you have anything else to add? Is there anything that we've missed that I have not asked that you'd like to speak on?
I'm just enthralled with the way that this hair treatment has been progressing, because we have people that are disheartened. We have people whose whole personality has changed due to the treatment with PRP. And I was a cosmetic and still am a cosmetic dermatologist. And this treatment has made my workday unbelievably pleasant, because people come in and they're happy. They're happy to see me. They're happy with the results. They come in, and for them, it's life-changing. So I can tell you that I'm happy that my practice has deviated into this area, and I'm extremely lucky that I've been able to provide these services, and I thank the patients for coming, and I'm very grateful that I can provide a service that people truly appreciate.
Yeah, because like a lot of treatment, it's not just physiological, is it? Psychological, I guess, in a lot of these
So
cases.
psychological. If people who have hair loss are devastated. There are people that can't walk past any mirror and look at the mirror because they're so devastated with the hair loss.
Mm-hmm.
And being able to help these people and see their whole personality change has been enlightening for me.
That's wonderful. That's wonderful. Well, you're doing a great job, and
thank you.
A lot of people appreciate it. And thanks for people and doctors around like yourself educating other doctors and helping patients with their conditions. It's really appreciated. Well, I've nothing more to say unless you want to cover any other points, Doctor.
It's great to see you, and I can't believe it's been 2.5 years. I tell you, 2.5 years has flown by.
Yeah, pretty crazy. So
I could tell that for the doctors and medical practitioners in the audience, they should check my website to see if they want to hear, if they want to be trained by me. We have it on my website now where they can check. We have links to the different lectures that I'm going to be giving. And we're coming out with a new consumer website because we've been asked to do this. And hopefully we're going to keep making advances and keep getting things together so that they're better and better and better.
Great. So for all those people listening, if you're interested in hair restoration and rejuvenation treatments, you want a consultation with Dr. Rapaport, what I suggest is you go call the office number, which will be above or below this video, or visit the webpage at prphairmd.com. And as Dr. Rapaport says, if you're a doctor listening, check out the educational content. Otherwise, I thank you for your time today.
Thank you, Craig.
Enjoyed it. Good.
Good to see you.
Yes, thank you. See you again next time.
Okay.
Thank you. Bye.
Bye.